So now let's do the anatomy of external ear. Okay. So what are the parts of external ear? Parts of external ear are pinna and the external auditory canal. Okay. This is the pinna, this is the external auditory canal. Okay. So now let's study each of them separately. Okay. This is the pinna. So what is the normal shape of pinna? What is the normal shape? Normal shape is when you can identify all the landmarks of the pinna, it is known as, it is said to have a normal shape. Okay. So what are the landmarks of the pinna? Pinna has various landmarks. This is the helix. Okay. Now the part opposite to it is this is the antihelix. Okay. This is helix. This is antihelix. Okay. This is tragus. So this part is antitragus. Okay. This part where it is attaching, this is the root of the helix. Okay. Now sometimes there can be a tubercle on the helix. This tubercle is known as Darwin's tubercle. Okay. It is of no significance, just that it can be present in some people. Okay. Then there are three spaces. Okay. These three spaces, this is the concha or the conchal bowl. Okay. This space is Simba concha. Okay. And this space is scaphoid fossa. Okay. So now what is the significance of Simba concha? Okay. What is the significance of Simba concha? We'll delete all of this. Simba concha is the surface landmark of mastoid antrum. Okay. So what happens if there is any mastoiditis? Okay. There is acute mastoiditis. So what do? You cannot, even before getting any investigation done, you can find out if there is mastoiditis or not. How? You can just press over the Simba concha. Okay. If it is tender, then the patient has mastoiditis. This is called mastoid tenderness. Okay. The sign is known as mastoid tenderness. Right. Okay. So now this is a only surface landmark. Okay. What is the bony landmark of mastoid antrum? It is the McEwen's triangle. Okay. We have studied that before. The bony landmark is McEwen's triangle. It is used for surgery. The surface landmark for clinical examination, we use the Simba concha. Right? Okay. Now let's look at this space, this gap. Okay. Let's look at the pinna cartilage. Okay. This is the bare cartilage which is forming the pinna. This is the elastic cartilage. Okay. You can see here that this part, okay, this part is not there in this diagram. So this is the lobule. Okay. This part of pinna is called as lobule. So it is not made of any cartilage. It is just formed of fibrofatty tissue. Okay. Rest of the pinna is made up of elastic cartilage. Right. Now you can see that there is a gap here in this cartilage. Okay. This gap is known as incisura terminalis. Okay. Why is this gap there? This gap denotes the site of fusion of the first and the second arch. Remember, we studied that before, that pinna is formed by fusion of first and the second arch. Okay. So the site of fusion of these two arches is known as incisura terminalis. This is devoid of any cartilage. So what is the significance of this incisura terminalis? Since there is no cartilage, you can give an incision here. Okay. Rest of the pinna, you cannot give any incision. Why? Because you should not cut a cartilage. You cannot incise a cartilage, because if it gets infected, it will cause perichondritis, and then it can be necrosed, and there can be a septal perforation, the cartilage perforation. Okay. So This site, incisura terminalis, can be utilized for incisions. What incision? Endoral or the Lempert's incision. Okay. So you can see here there are the three approaches which are utilized for the surgery, ear surgery. This is the transcanal or the permeatal approach. Okay. Then this is the endoral approach. Okay. Then this is the post-oral approach. Okay. So this incision which is used in transcanal, it is a permeatal incision. This is known as Rosen's incision. Okay. Endoral incision is known as Lempert's incision. Okay. Now the post-oral, the most common approach used, the most common incision we give is the Wild's incision. Okay. Wild's incision. It is named after Sir William Wilde. Now let's come to the external auditory canal. Okay. So the external auditory canal, okay, this lies from the pinna to the tympanic membrane. Okay. It is around 24 millimeter in length. Okay. But around 1/3 of it is cartilaginous and 2/3 is bony. Okay. So this is around 8 millimeter and this is 16 millimeter. Okay. Also, this is at an angle to the vertical, to the horizontal. It is not straight. Okay. So you have to, when you are examining, you have to straighten it. Okay. But it is not fully developed in children. Okay. So you have to pull the canal downwards and backwards in children and upwards and backwards in adults. Right? This can be a question which can be asked. Okay. Now we come to certain openings which are there in the external auditory canal. These openings are fissures of Santorini. Okay. These fissures are there in these openings are there in the cartilaginous part. Okay. The outer part. And there is a foramen here. Okay. In the bony part. This foramen is known as foramen of Hashka. So these foramen and these fissures, they connect the external auditory canal to outside, okay, to the parotid gland. So any infection of the external auditory canal, it can travel to parotid, and any infection of the parotid gland can travel to external auditory canal through these fissures and foramina. So this is very important clinically, right? There may be a patient who comes to you with ear discharge, right, in emergency or in OPD, and you look at the ear, right? It is all right. The tympanic membrane is all right, right? You cannot see any perforation. The external auditory canal is fine. There is no otitis externa. So where is this discharge coming from? So you have to look at the parotid gland. There might be a parotid abscess. Okay, that pus is coming in the external auditory canal through these fissures, right? Okay. So let's come to earwax. Okay. So what is earwax? What is earwax? This is a very common term which is used by people. Earwax is a collection of secretions and some material which are found in the external auditory canal. This can be asked in the question, and some people mark it as ceruminous gland. Okay, cerumen. So wax is not cerumen. Okay, what is cerumen? Cerumen is the secretion of the ceruminous gland. Ceruminous glands. These are special glands which are present in the external auditory canal. These are modified sweat glands. So cerumen is a kind of sweat. Okay. but this is not wax. Okay. What else is there in the external auditory canal? So these are present only in the cartilaginous part, the outer part of the external auditory canal. Okay. So what else is there? There is sebaceous glands. Okay. So their secretion is sebum. What else is there? There is hair. Hair in the external auditory canal. What do? They trap the dust and they trap the bacteria. So the trapped dust is there. Okay. What else? There is skin which is lining the external auditory canal. So there are dead epithelial cells. Okay. So the mixture of the cerumen, okay, the sebum, the hair, okay, the broken hair, and the dust and the dead epithelial cells. The mixture of all these 5 things, okay, that is known as wax. Okay. Wax is not cerumens. Wax is a mixture of all these things. Right. So let's come again. So the external auditory canal, it around 6 millimeter, okay, 6 millimeter lateral to tympanic membrane. It is the narrowest there. Okay. This narrow place is known as isthmus. Okay. This is known as isthmus. So what is the significance of isthmus? Whenever there is a foreign body, okay, there is a patient puts in bead or anything, this foreign body is most likely to go and get stuck at isthmus, right? Okay. Now let's come to the tympanic membrane. Okay. So tympanic membrane, as we studied earlier, is a trimeric structure. Okay. It has 3 layers. Okay. First is derived from the ectoderm, middle one is derived from the mesoderm, and the inner one is derived from the endoderm. Okay. This is known as the epithelium. This is fibrous layer and this is mucosal layer. Right. So these 3 layers, all 3 layers are there in the tympanic membrane. Right. So let's study the parts of the tympanic membrane. Okay. So what are the parts of tympanic membrane? You can see here, this is the tympanic membrane. It is around 9 into 11 millimeter. Okay. In diameter. It is an oval shaped. You can see here, this is the oval shape. This is not a circle. Okay. This is oval. And largest diameter is this. This is 11 millimeter. And the shortest diameter is 9 millimeter. Okay. And the color is pearly grey. Normal color is pearly grey. Right. In some books it is written pearly white. You can see according to the question and if the both options are there, most correct answer is pearly grey. Okay. Then you see there is a white condensation here. Okay. This condensation, this ring is the fibrous annulus. Okay. The condensation of the middle layer or the fibrous layer is the fibrous annulus. So what happens? The tympanic membrane is attached to the external auditory canal, and the annulus of the external auditory canal is the bony annulus, and it gets attached with it by the fibrous annulus. Okay. Now you can see here that this annulus is absent superiorly. Okay. So this is a notch which is formed here. This is known as notch of Rivinus. And you can divide, there is a tympanic membrane here. So you can divide the tympanic membrane into 2 parts here. Okay. This is the pars tensa. And the upper part is the pars flaccida. Okay. As you can find out from the name itself, okay, pars tensa is tense, okay, flaccida is flaccid. Why? Because tensa has the three layers of the middle layer of the fibrous layer is, here it is densely organized. Okay, the fibrous stroma is densely organized, but in the flaccida, what happens is there are two reasons. Firstly, the middle layer is thinner here. Okay. Secondly, the fibers are loosely organized. Therefore, this tympanic membrane is flaccid. Okay. Let's delete all of this. Okay. So now you can see here, this is the tympanic membrane, the handle of malleus, and this tip is known as the umbo. Okay. Here you can see some reflection of light which can be seen. This is known as cone of light. Okay. So why the cone of light is there? Because you can see in this diagram, the tympanic membrane is at an angle. Okay. So this is the external auditory canal. The tympanic membrane is like this. Okay. It's not straight. It is attached like this. So it is forming an angle of 55 degrees. Okay. So that is why when you are examining, we show the light, okay, inside, that gets reflected at an angle, and there is a cone of light. So cone of light is there in the inferior quadrant. Okay. So these quadrants we learn later, right? Okay. So let's come to the quadrants. So we can see here, this is the handle of malleus. Okay, this is the handle of malleus. If we draw a line passing along the handle of malleus, okay, and then a line bisecting it through the umbo. Okay, so now we can divide the tympanic membrane into 4 parts. Okay, this is anterior, this is posterior. So this is antero-superior, this is antero-inferior, this is posterior-superior, this is posterior-inferior, right? Okay. Now let's come to the nerve supply. Nerve supply of Pinna. So this is very important because in exam you can be asked not just to name the nerve supply of Pinna. You can be given a diagram and an area will be marked, and you can be asked that what supplies this area. Okay, so you should know the whole diagrams as well, right? So this is the lateral surface of Pinna and this is the medial surface. Okay, so here you can see this anterior part is supplied by the auriculotemporal nerve, which is the branch of V3 or the mandibular division of the trigeminal nerve, right? Now this inside part is supplied by the 7th, the conchal bowl is supplied by the 7th and the 10th nerve, right? Now the majority of the Pinna is supplied by greater auricular nerve. Okay. Now we come to the medial surface. Medial surface, the inner part is supplied by the same 7th and the 10th nerve. Okay. Most of the part Pinna is supplied by the greater auricular nerve, except for the superior part, it is supplied by lesser occipital nerve, right? So what is the significance of greater auricular nerve supply to Pinna? So what happens is that in certain conditions, okay, in certain conditions what happens is there is anesthesia over the Pinna. What conditions? In leprosy. Okay, in leprosy, major nerve to be involved is, there is thickening of nerves in leprosy. Okay, so greater auricular nerve is thickened and in leprosy, so there is anesthesia over the Pinna. Okay, this is one of the first signs of leprosy. Okay, secondly, whenever you do a neck dissection, okay, In neck dissection surgery, we should preserve the greater auricular nerve. Okay. Sometimes what happens is due to for better exposure during the neck dissections, we cut the greater auricular nerve. So in post-op period, the patient may complain of anesthesia and paresthesias over the pinna, right? Okay. Now let's come to the nerve supply of the external auditory canal. Okay. So this is the anterior part, this is posterior part. Okay. So you can remember this as that anterior part. You can divide the quadrants of the external auditory canal according to the tympanic membrane quadrants. Okay. So this is the antero-superior, this is antero-inferior, this is postero-superior, and this is postero-inferior. Right? So now how can you remember this? That's anteriorly we have the parotid gland. Okay. So parotid gland gets its supply from auriculotemporal nerve or the fifth nerve. Okay. So antero-superior part of external auditory canal gets supply from fifth nerve. Right. Now we come to the antero-inferior part. Okay. It is supplied by vagus or the 10th nerve. What branch? Arnold's nerve. This branch is known as Arnold's nerve or the Alderman's nerve. Okay. So now, how do you remember this? So whenever you are cleaning, remember whenever we are cleaning the ear, most often we touch what part of the external auditory canal? We are bound to touch the inferior part. Okay. So now inferior part, when we are touching it, what happens to some patients? They have cuff reflex. Okay. So cuff reflex is occurs due to 10th nerve. Okay. Now what branch of 10th nerve does the cuff reflex normally occur? Due to internal laryngeal nerve. Right. It supplies the sensation of the larynx. But in case of external auditory canal, the cuff reflex, if happens due to cleaning, it occurs because of Arnold's nerve. Okay. So antero-inferior part is has got its blood supply from the 10th nerve or the Arnold nerve. Right. The posterior inferior part has got its supply from postero-inferior part. Okay. Postero-inferior part has its supply from C3 nerve. Okay. Now we come to the postero-superior segment. Okay. Postero-superior segment gets its supply from the 7th nerve or the facial nerve. Okay. So what is the significance of this? 7th nerve has two divisions, sensory and motor. Okay. So sensory nerve, also known as nervus intermedius. It is a very small nerve, very thin nerve. Okay. It accompanies the motor division in the internal auditory meatus. So any lesion of the internal auditory meatus, okay, any lesion like vestibular schwannoma, okay, what happens if there is a tumor in the internal auditory meatus? It compresses upon the 7th nerve. So since the sensory division is very small, very weak, it gets compressed faster. It produces symptoms, sign earlier, right? So if you test this area, you touch this area, and if there is anesthesia here, okay? So if there is anesthesia, this sign is called as Hitzelberger sign. Hitzelberger sign. Okay. So this sign is seen in vestibular schwannoma. Okay. There is anesthesia of the posterior wall of the external auditory canal, which is supplied by the sensory division of the facial nerve. Okay. So this sign is known as Hitzelberger sign. Okay. Now let's come to the nerve supply of tympanic membrane. Now this is the lateral surface of tympanic membrane. the outer surface of tympanic membrane. Okay, so again you divide into anterior and posterior. Okay, anterior part gets its supply from the fifth nerve, auriculotemporal nerve. Okay, and posterior gets a supply from the 10th nerve. Right? Now the medial surface or the inner surface of the tympanic membrane gets its supply from 9th nerve. Which branch? Jacobson nerve. Jacobson's nerve. Okay. This nerve supplies the whole of the middle ear mucosa. So therefore, tympanic membrane also has inner layer as mucosa. It also gets supply from Jacobson's nerve. Okay.